This is the Johnson, Vorhees, and Martucci podcast series. I am Patrick Martucci, and I'm here with my esteemed partner, Scott Vorhees.
Good morning.
Scott, today we are going to be discussing an unpleasant but very important subject matter called elder abuse and nursing home negligence. As our society ages and the baby boomers have come around and reaching the age of 65 plus, a lot of these topics are going to become even more and more prevalent. They're going to be more common and certainly information that everybody needs to know. So we're going to be discussing elder abuse and we're going to be discussing nursing home negligence. Scott, what do you think of first when you hear the idea of elder abuse?
Oh God, how do I avoid that? I mean, honestly, it's probably a fear that all of us have. And while death is certainly very scary, anymore I see people are living longer and we're able to do a lot of things with medicine, but so many people need in-home care or being in a care facility. And of course, in my family, we've had people who've had to be in homes, and it just seems like we hear all these bad stories and these, almost horrific events that occur to people, whether it's through neglect or abuse or exploitation. And I just keep telling myself, man, I don't want to end up there.
Yeah, and a lot of elderly people end up in those types of facilities for good reasons as well as other reasons. The I guess unfortunate reasons might be they don't have other loved ones that can take care of them, or maybe don't have the means to be able to stay within the home or a loved one's home. But a lot of them need that type of care that nursing homes can provide, just because of their other ailments, their other sicknesses, that is just more than family members can maintain. Now, that doesn't mean that they're stuck in these nursing homes and no one comes to see them. In fact, according to the U.S. government, one of the best things you can do to prevent abuse or neglect of when you're elderly loved ones in one of these facilities is that you take an active role to prevent elder abuse by staying involved in your loved one's life, staying involved in their care, finding out the information from the nursing home as to their needs and the problems they might have, and being there not only to assist the loved one, but being there to assist the nursing home and their staff to better communicate with them and help them understand their needs so that they in turn can report what they're needing and get the best quality of care and live the longest and fullest life they have.
Yeah, that's what we see too, is most of the time whenever we see folks who aren't getting good care, we find out about it because they have a loved one who's checking in on them and who's there to kind of pay attention to what's going on. Because a lot of times the older person who's in need of care either doesn't know what's going on or can't communicate well with the outside world about, hey, my needs aren't being met, or I'm not being fed or watered or turned or whatever it is. And so you're absolutely right that if we have people to go in regularly and check on them, friends, family, loved ones, what have you, then the incidence of abuse and neglect goes down and the incidence of reporting and correcting goes up, which is just, that's the number one thing, is have people around you so that you can be cared for. The other thing, though, I want to make sure we talk about is it's not just in nursing homes. We can have in-home care providers, too. Like in my perfect world, I'd be able to stay in my home as I get older and just, bring in a little extra assistance with, some of the things that I can't do for myself. And to the extent that we can help people stay in their homes with good quality care, home health aides, those kinds of things, I think that's great too. But we got to watch, because sometimes that ends up creating another opportunity for exploitation or abuse, and that would be the financial, where people get tricked into changing their wills or buying things for those people who are supposed to be taking care of them, but instead are just using them.
Yeah, you raise a good point, and it's an unfortunate statistic, but I was looking over some of the Missouri statistics regarding elder abuse and abuse in terms of forms of financial abuse, exploitation, and it was amazing how high a percentage it was that actually came from family members or close friends.
Yeah, I don't remember what the stats were on it either, but I want to say the vast majority of abuse cases come from someone who's a loved one or relative, which is just crazy.
And that just means it's important to have other loved ones and relatives that are watching over them. If you have a loved one that is willing to undertake that care, oftentimes it's for good intents and purposes, but when the care becomes I don't want to say a burden, but when it comes too much maybe for them to handle within the home, they start to feel, well, maybe I'm entitled to a little more because I'm the one that's taking care of my parent or my grandparent, and I think I should be compensated some way. And it just becomes a situation where it turns into the abuse, whether for or neglect or for the exploitation, whether for harmless purposes or actually outright harmful purposes.
One of the things too we see a lot now, here at least, is in most of those cases where there's exploitation, it's usually because the caregiver has an alcohol or a drug dependency issue that also is involved. And so sometimes it's I'm there taking care of grandma or grandpa, and I'm really there taking their narcotic medication, or I'm trying to steal from them to support some other habit that I have. So again, like you mentioned, it's great to have the support system to more than one person. And I did see one of the stats there. It was 90% of elder abuse comes from a relative, family member, or spouse, significant other. 90%. I mean, that's crazy.
That is an amazing number. And the population of the people who meet the definition of an elderly person is just becoming more and more. Missouri's population is about 5.5, 6 million. We have more than 1.17 million people that are 60 and older, so that's about 20% of our population.
And wait a minute, 60's elderly now?
Well, yeah, maybe for
when I was 20,
young guys.
I thought that. I don't think that's elderly anymore.
But as you get older, the more precious your life is. The shorter your time to live, the more important your dignity, the right to live injury and pain-free and neglect-free and exploitation-free is important. They call it the golden years for a reason.
But that's because it costs a lot of money for your care. Is that not why?
No, that's true. But the dignity that goes with that, and if I had one day to live, I'd want to make that day the best and most I can. These people sometimes have 1 to 5 to 7 years to live, and they want to make those the best years of their lives.
That's one of the things we face a lot of times when we're bringing, as you know, wrongful death or neglect or abuse claims is sometimes we get folks who think that, grandma or grandpa or whoever it is only had another year and they were neglected or abused the last 6 months of their life or the year of their life. But really, as you mentioned, that's the most precious. And that, to me, when you're totally dependent and you're in that situation, I don't think that that's a reason where a jury or the public should discount that value. Instead, I think I'm with you on that. That's the most precious time. That's where, if no other time in your life you ought to be treated well, it's after you've earned that golden year of retirement where you should be taken care of and looked out for.
I agree. And another thing that makes these types of cases that much more deplorable or that much more sad, is more sad a word?
Sure. That's 2 words. 2 words.
Sad,
I'm pretty sure.
Is that oftentimes these people are so vulnerable, just like young children. The elderly and young children are vulnerable to these types of crimes. In a sense, they have become more trusting of people. They've lived their life. Now they're in their age, their senior years, and they become more trusting of people, and they're vulnerable. They can't often defend themselves, can't often communicate as well as they need to. And people who prey on these types of people, I think it's not a situation where, okay, they had 1, 3, 5 years left to live, that their life had any less value. I think it has more value, and the acts that occur to harm these people are that much more deplorable because they are so vulnerable.
The other thing we got to talk about a little bit is kind of what we do to help address this as a law firm, because I don't know if everybody who's listed knows that one of the areas that we handle is abuse and neglect cases in nursing homes. And we've been sort of focusing a little bit on the abuse, where you have somebody who's got a bad intent, who's trying to take advantage of an elder person or somebody who's got dependent care needs. But, the stats now are like 95% of what we see are really neglect cases, where it's not that somebody's gone in and abused or even exploited an older person, but it's where they have just flat out neglected them. And as you know, we see a growing elderly population who needs more and more intensive care. And instead we see understaffed, underpaid, and seems like uncaring nursing homes and facilities. And it's really neglect that I see. I can't tell you how many times you and I have worked on cases where you've got a pressure wound or you've got a urinary tract infection that has allowed to go untended, and so somebody ends up septic and dies from a completely preventative issue. And that's what I see, and that's just what amazes me and saddens me. And and frankly pisses me off.
Yeah, that's right. Maybe we should go ahead and kind of break it down into categories. And first, perhaps we could talk about nursing home negligence cases, then we'll talk about other forms of abuse.
Now, let me stop you for a second. When you say negligence and I say neglect, are we talking about the same thing or different things?
Essentially, we're talking about the same thing, whether it be negligence or neglect, and we can kind of define that legally. There is what is called a standard of care in Missouri. The standard of care, simplified, is what nursing homes should do, the minimum standards they should live up to provide care to an elderly person. Now, those standards often come from the federal government in the form of Medicare standards. They may come from their own state, Missouri state regulations and Missouri standards. They may come from the policies and procedures that that nursing home has set for themselves, or just the standards that are out there and known in the medical community called medical standards of care for treating certain ailments or for treating the elderly.
Now, let me talk to you about that real quick.
Yes.
Though. We're talking about minimums there. So all of these guidelines, policies, regulations, that would be the very minimum, the least amount of care you could get away with.
That's exactly right. The minimum standards of care to be an adequate, to be a competent nursing home facility. And if you fall below those minimum standards by not providing those levels of care, by not meeting those regulations set forth by the government, then you can be considered negligent. It is not living up to the standards that are set by the government or the nursing home industry, falling below those standards that causes or contributes to cause harm or death of a loved one. That is what we're talking about when we're talking about nursing home neglect or nursing home negligence. There are various statutes. In fact, in Missouri, the state where we practice, there are a lot of statutes that regulate nursing homes. One's called the Missouri Omnibus Nursing Home Act. Also, the Medicare federal government regulations. There's a lot of regulations that nursing homes must follow if they want to receive Medicare benefits. Those are often a very good source to look for to see if nursing homes are living up to that standard of care. And they have two components really to these types of cases. One is even a loved one or someone who feels that an elderly relative is not getting adequate care. They can call the Missouri Attorney General and they can report the neglect to the Missouri Attorney General. Attorney General can do an investigation and see if deviations or violations occurred. And if the Attorney General finds that there are violations, the Attorney General can step in and take action. If the Attorney General decides not to take action, well then an individual relative can. But separate and apart from that, Missouri has its own civil laws where the victim of neglect or even one of their family members can bring their own civil claim against the nursing home.
So one of the things that you were talking about there was the Attorney General. It reminded me of the Hotline article that I'd seen a few months ago, and it just, again, amazes me about the world we live in sometimes, because there's a hotline if you want to report elderly abuse. And the article said that about 39%, almost 40% of those calls went unanswered. I was like, how do you have a hotline that doesn't get answered? And apparently they had dropped calls, disconnected calls, and they fixed that now. But for a month or two there, they were saying, hey, by the way, if you can't get through on the hotline, fax us. And they got 1,200 faxed complaints. It was just amazing to me. But you can always call our law firm, you can call other law firms to do what we do, because oftentimes these state agencies, whether they're overburdened with calls, can't get the calls through, are understaffed. I think they had a 40% increase in calls and they added one staff member. So a lot of times the private remedy, you're going to get more hands-on, faster, better attention than you would going through the state.
Yeah, that's true. I mean, just you say 1,200 faxes. I don't imagine they have at the Attorney General's office anywhere near that number of staff that can, one, adequately review the complaints, contact the loved ones, but then undertake an investigation. These investigations often require going out to the nursing home, interviewing staff, interviewing the resident, the elderly person, interviewing the family. That's just more than any one agency can handle. And it's also, coming to us, we could assist you with filing that complaint to make sure it is one perhaps that stands out above the others and it gets the investigation it needs. But more importantly, understand if the Attorney General steps in and they do an investigation and they find violations, that does not provide any compensation to the elderly person or their family. You need a civil lawsuit by a civil lawyer such as us to actually bring a claim on behalf of the elderly person or the family in order to get compensation.
I know one of the things when we're talking with folks about this is they're wondering, so why are there so many nursing home neglect or abuse cases? Why do those facilities seem to have these problems? And it goes back to what you and I have talked about early on, is the understaffing, undertraining, and just the overworking. And what you were talking about earlier with the regulations, the minimum amount of contact that a nursing home facility has to require ends up being basically this point of contact for this person so many times a day. Well, to meet those minimums, theoretically, if you had somebody who woke up at 8 o'clock in the morning and the staff interacted with that person just to the minimum, their interaction could be done by 11 o'clock. I mean, it's that minimal. Now, ideally, they're spaced out through the day, so they're being checked on. But there are a lot of times where, candidly, you can have somebody sitting in their own urine or in their own feces or not being fed or watered for the majority of the day, and nobody ever knows about it. And so, again, these facilities, most of the time, like 95, 96% of the time, it's not an abuse, it's just a neglect. Is you have too many people who are being warehoused by people who don't have the training to go in and know when, Grandma Mary or Aunt Mary is acting funny. It's probably not because of her medications. It's probably not because she has Alzheimer's or dementia. It's probably because she has a UTI, a urinary tract infection, that's getting worse. And so we need to get a urinalysis, and we need to get that to the attention of the doctor. But so often we have overcrowding, understaffing, underpaid, and that's just a system problem. It's only going to get worse. As you mentioned, the baby boomers are aging into that. And as you get older, the odds of you becoming a victim of an elder abuse or neglect go way up. And I'm not talking about just because you become elderly, but I'm talking about between 60 and 80, you're not as great a risk as after 80. Your risk like triples. It's crazy.
Right. And adequate staffing and properly trained staff are two of the key components that I see in these cases. Oftentimes they just don't have enough staff. They're spending less and less time with the resident, or they just don't understand the resident's needs, and they're not properly trained. A little bit farther down from that would be not having adequate facilities or not having adequate equipment.
That's one. Yeah, you deal with a lot with these falls.
Yeah, I was involved in one case, and it arose out of a fall where the assisted living portion of the nursing home, which is where the residents need hands-on care, as opposed to some of these areas that they have just sort of monitoring. They're in a residential area, they just need monitoring. But the area of the nursing home where they actually need hands-on care, assisting in and out of the bed, in this one facility, it was a locked facility because some of the residents were elopement risks, meaning they would wander out and leave the facility.
Go get married?
Yeah. Wander out of the facility, where this one poor lady that wandered out once and fell. And the staff knew that there was one route, a very common route, that the residents could go through and never have to pass a locked door. And then they could just walk right out of the facility. And they knew that was a problem, and they just never fixed it. Well, lo and behold, this lady went out that route, went outside and fell and broke her hip. And it was a family member of another resident came in and said, hey, you have one of your residents outside laying in the parking lot hurt. So just not having the proper equipment, not having the proper facilities, and just not going through and, I guess, looking for a fail-safe method so your residents can't get hurt. But that goes back to staffing and training and all that. So there's a lot of areas to look for. Let's talk about the Medicare Act. And when you're kind of looking at these cases and you're looking at the areas that nursing homes, the standards nursing homes need to meet, the Medicare has set forth in place certain regulations, certain guidelines the nursing homes have to follow, and it's called a minimum data set. Now, this is the information that all nursing homes have to maintain if they're going to receive Medicare, and just about all nursing homes do receive Medicare. And there are certain components to that, and these are the areas where oftentimes nursing homes are found to violate or just not keep up-to-date information. So the first thing when a nursing home receives a resident, they need to do an assessment. This is an assessment, a full assessment of their physical needs, their emotional needs, any sort of limitations they have in walking or meals or something like that. They have to do a careful and thorough assessment upon the admission. And then they also have to do it, I believe, every month or every few months. After they do the assessment, then what the nursing home needs to do is they have to do care planning. This is creating a plan of care for taking care of the issues identified in the assessment. For example, does this person wander? Do they try to leave the facility? Do they have difficulty walking on their own? Do they wet the bed? After they create this plan of care, the next thing is they have to communicate the plan of care and distribute it to every individual that's going to be responsible for providing any care to that resident. And that's often an area of failure is you speak with the administrators or the nursing staff, the registered nurses. And you understand, a nursing home, you'll have registered nurses, then you have people who aren't registered nurses or aren't certified or licensed care providers. They're entry-level care providers. And it's often the entry-level care providers don't know what the plan of care is for that resident. The higher-ups, the registered nurses might, the administrators might, but the people who are actually assisting these people out of bed or changing their sheets, that type of thing, do not know. So it's important for the communication component that plan of care be communicated to every single person that's providing care to that resident. Of course, then you have to implement the plan of care properly. That gets back to having adequate staffing and staffing that's trained properly. And then lastly, you need to reassess and try new things if the things you already have in your plan of care aren't working, or if the needs of that elderly resident change. So it's a thorough assessment upon admission, creating a plan of care for the assessment, communicating that plan of care to everyone involved in the care, implementing the plan of care with proper staffing, trained staff, and proper equipment, and then reassessing and trying new things. When I get involved in these cases, that's almost always the first thing we look at is what was the assessment, what was the plan of care, and did they change that assessment if the patient continued to have falls or continued to wander?
That's one of the things that we see a lot is we know that, again, grandma or grandpa is a fall risk, and then precautions weren't taken to reduce or eliminate that fall risk. Or we know that we've got somebody who's got dementia or Alzheimer's, but you don't keep them in a locked facility, that kind of thing. Again, the dementia and Alzheimer's, the mental altered state has become an area where we see more and more people who are abused because they can't report it, they can't communicate what their needs are. It's hard for them to tell somebody, hey, I need to be changed, or I haven't been fed or watered today, or what have you. And the stats are reflecting that, as now 47% of people with dementia or Alzheimer's are the victims of abuse or neglect right now in facilities. And it's just, again, that number continues to increase. We've been going for a little while. Let's take a quick break and then come back and shift topics just a little.
Yeah, when we get back, we'll talk about the most common types of claims you see in nursing home negligence cases.
Perfect.
At Johnson, Vorhees, and Martucci, we handle serious injury and wrongful death claims.
Proving the owner knew or could have known of the dangerous condition is something that is important.
A wrongful death case springs from a negligence claim of some type.
Any good personal injury attorney will give you a free consultation.
Well, just because you've been injured on someone else's property, such as fallen, doesn't mean you have a case.
If you're wondering whether or not you need to talk to an attorney about a car wreck, the answer is yes, you do.
Welcome back to the Johnson, Vorhees, and Martucci podcast series. Today we are discussing elder abuse and nursing home negligence cases. I'm Patrick Martucci. I'm here with my partner, Scott Vorhees. Just before we took the break, Scott, we were talking about things that nursing homes have to do to provide adequate care. Now we're going to talk a little bit about the most common types of nursing home negligence cases that we see and that are reported across the country. The number one type of negligence case that seems to be coming up is pressure sores.
Yeah, you say pressure sores, bed sores, pressure wounds. We're all talking about the same thing. And that's basically where somebody's left in a position in a bed or in a wheelchair where the skin breaks down, becomes infected. Usually it starts with something as simple as cellulitis and redness and then can go all the way to the bone.
Yeah, it can move relatively quickly too, depending on the amount of circulation they have in that area of the body. But pressure sore, if you've seen one, if they're advanced, and we'll talk about the various stages, but if you've seen one, it is an ugly, nasty thing.
Incredibly painful.
Yeah. They are like 4 stages, 1, 2, 3, and 4. 1 is just where you have some redness on the skin, and then 4 is where it's tunneled all the way down to the muscle and to the bone, and it's even exposed. These things they're difficult to treat once they've started, so prevention is one of the best things. If you've heard, and half an ounce prevention is worth a half a pound of cure, that certainly is true in pressure sore cases. Once they start, you need to properly treat them, but they do not bounce back quickly, and they are extremely painful. They need surgery to debride the dead, infected tissue, and it goes on, and it's very painful for the person who has pressure sores. And I've seen several pressure sore cases, and they break my heart, and the pictures are just horrific. And nursing homes and hospitals are required to take pictures of the pressure sores to document the staging and document the advancement.
But let me stop you there, because sometimes people think that if I've got a mom or a dad or grandma or grandpa in a nursing home who can't move and who can't control their bowels or bladders, that it's just inevitable they're going to get a pressure sore. And do you think that's true?
That is not true. In some limited circumstances, pressure sores can be inevitable, though it's a heavy burden for the healthcare provider just to prove it was inevitable.
Yeah, I'm going to say it the other way. You should not ever get a pressure sore if you got proper care.
Right. I don't like to say ever and ever, but pretty much in pressure sores, I'm going to say that. There are a lot of things they can do. There are wedges that help turn the person. There are beds. There are pressure relieving mattresses. And there are various stages of these mattresses that actually, some just fill with air. Some actually are self-turning mattresses. In other words, they will adjust the air in the bed to help turn the patient physically. There are wedges they can use to turn the patient on their side and keep them on their side. And most care plans provide that you need to turn the patient every hour to every 2 hours, depending on the degree of their disability and their risk for pressure sores. But it's just a question of turning the patient, whether physically or using one of those mattresses or one of those devices to make sure that they are turned.
Let me swing back to what you talked about, too, the importance of having a loved one check in on you. Because a lot of times, although you say the care facility is supposed to take pictures of the pressure sore, we know that doesn't happen. And even though you're supposed to have somebody who turns somebody or puts them in the right kind of bed, we know that doesn't happen. And so as you go visit your loved one, or you have somebody who's got a friend or family member in a nursing home or a care facility, encourage them to make sure that they're being turned, that they're addressing the pressure wounds, that they're having any progression of skin breakdown monitored closely. And I tell folks, hey, look, don't be afraid to take your own pictures. Don't be afraid to get out there and be vocal, because a lot of times the nursing home is trying to do what they can with the limited staff they have. And if you can alert them to a developing problem, you can save yourself and your loved one a whole lot of trouble and pain later.
Yeah, I hear that from time to time, actually quite frequently when I meet with families who feel their loved one in a nursing home has been neglected. They say, boy, they probably didn't like me at that nursing home because I was very vocal. I was always complaining. I said, you did exactly what you're supposed to do. That's the way to get the best care, whether it's just in a hospital outside of the nursing home context. They say, if you can have a loved one stay with you in the hospital, that is the best thing you can do, because it prevents mistakes and it makes sure that you're getting care. It's kind of like the squeaky wheel gets the grease. And if I'm in a hospital or nursing home, I want to be the squeaky wheel because I want the grease every time. So getting back to these pressure sores, you talk about making sure they're turned. Hospitals, nursing homes, they have to document. They have hourly rounding sheets and hourly turn sheets, flow sheets. They actually have to document what position the patient is every hour, every 2 hours. And so that's a source to look at. And in most cases, they don't do the documentation correctly. I've had cases where it shows the person is left on their back for 8 hours.
Speaking of the other types of claims that we see, you said that we were going to cover a whole bunch of them. We're going to run out of time. Pressure wounds is one that you and I have talked about. We see a lot of. What are some of the other common ones?
Another common one is falls, where a loved one goes into a nursing home and they fall because they're not supervised, they're not given the walker, or they're not monitored. An assessment of their ability to walk needs to be done. That's part of the assessment portion of it. And if they can't walk on their own, they need assistance getting out of bed. They also might need someone to walk them back and forth to their room. Falls is a very big one. I see more fall cases than probably any other case.
So let me stop you there again, because sometimes we have folks who come in with the idea that, hey, I got, grandma, grandpa, and she's got Alzheimer's or dementia or what have you, and falls are just going to happen. Do you agree with that?
In limited circumstances, falls can happen. But I think in most cases, anytime a resident falls within a nursing home, something has gone wrong, whether on the assessment or they left things in the hallway or in their bedroom they should not have, or they just were not being properly monitored by staff.
I'm not going to get you to say never, am I?
You're never going to get me to say never. Okay, I will never say never. There you go.
But falls should not happen.
Falls should not happen. I agree with that. I agree with that. Especially, you can say, this is not true, but the one dog bite rule, maybe one fall, maybe they get by with the one fall. I had a case where this lady had 13 falls in a nursing home. Jeez. And it was the last fall that was the fatal fall. That they had 12 opportunities to prevent that woman's death just by implementing the care plan and changing the care plan. That's really what it needed to be done. They just kept doing the same thing over and over. Well, if you're doing the same thing over and over and it fails, that's kind of the definition of insanity.
Right.
You can't do the same thing over and over and expect different results. Another area where I see common claims is failing to respond to a change in the patient's condition, where the residents in the nursing home and they get worse, whether their health condition changes, whatever it might be, but they're not changing that care plan to respond to those changing needs. And as a result, the person continues to deteriorate and they don't get better.
Now let me stop there, because this is the one that I see the most. Is most of the time it's a developing infection. It's a urinary tract infection, it's sepsis, where you've got somebody who's got an easily treatable condition, but it's let go for so long that now it becomes either really difficult to treat or becomes fatal. So a lot of times I have folks come and ask, like, why does that happen? And my answer is usually because of understaffing and the fact that to get a change in the care plan, you almost have to get a doctor's attention. And I don't know if you know how this works, people who are listening, but almost always you have a doctor who is a part-time supervising physician over at least one or more nursing homes. And so that doctor is not physically on site most days. That doctor is not personally paying attention to your loved one most weeks. And so to get a change in the care plan, to get somebody to come in and recognize what's going on or developing with your loved one, usually does take that squeaky wheel, does take that person saying, hey, by the way, Granny is not acting normal. There's something going on here. I need you to get a hold of the doctor. I need you to have them order urinalysis, or I need you to have an assessment done.
That's right. Another one of the regulations is that nursing homes must contact the family immediately upon a change in the resident's condition. And I hear that a lot. I did not know, for example, I might say, I did not know my loved one had 3 falls before this. Right. Anytime there's a fall or a significant change in the condition, the nursing home must immediately notify the family.
Yeah, I can't tell you. It is a rarity that happens in the cases that we see. I mean, that just does not happen. Exactly.
Another area of negligence cases that comes up is a physical and sexual abuse. I think that's pretty self-explanatory and the most egregious type. A dehydration and malnutrition. There's a large area of claims based upon the loved one just not being fed properly or not being watered properly.
Can I swing back to the abuse for a second? We talked about physical and sexual abuse,
yes.
But the other thing that you and I know feel is important is the dignity. A lot of times there's verbal abuse. There is just a dehumanizing of the patient where, for whatever reason, they're not treated like real people. They're not protected and given the dignity that they deserve. And that can also give rise to a claim and complaint. And so it doesn't just have to be physical or sexual abuse. It can also be verbal and mental abuse, emotional abuse. And I think that's important to know, because one of the worst things that I have seen is people who are completely dependent on caregivers who are being treated worse than I would treat, a rabid dog. It just infuriates me.
Yeah, there are many types of abuse, and even the Missouri statute defines abuse as the infliction of physical, sexual, or emotional injury or harm, including financial exploitation by any person, firm, or corporation. So physical, sexual, or emotional, all those types are considered abuse.
Sorry, I sidetracked you. Go ahead.
No, that's fine. Other common areas of negligence we see are medication errors. You have usually about twice a day that staff is going through and they are giving medications, and they're giving it to dozens, if not hundreds, of residents, and they get those medications confused. And oftentimes it's a repetitive thing where they keep making that mistake, and that can have very harmful and damaging effects to someone who's getting a medication they should not be given.
That's another thing. If you've got a loved one in the hospital, make sure that you have an awareness about what medications they're supposed to be getting, and then you know what the pills look like, and you can go and spot check, if you will, whether or not they're actually getting those. Because a lot of times it's just an error, it's an oversight. There's been a change in the medication from the last physician visit that doesn't get communicated or doesn't get followed. But also sometimes there can be bad reasons. We've had instances where employees were stealing narcotic medication from the resident. And of course, now you've got a resident who is suffering in pain because they're not getting the pain relief, and nobody knows.
Yeah, that's right. That's right. And it's important to show, all you have to show is negligence, that they did not meet those minimum standards that were required. You don't have to show that they intended to harm the resident. That is not required. Just to show the nursing home or staff did not live up to those minimum standards that they were supposed to, whether just by oversight, inadequate staffing, inadequate training, or intent. But you do not need to show intent.
One of the things that we get asked from time to time is, all right, so, my loved one's not being cared for the way I think they ought to be. I don't know if there's something here. Can I come and talk to you, and what does it cost? And we try and tell folks that you are always welcome to call our office in any of the 4 states area, anywhere outside the 4 states for that matter. We associate with other councils because it's free to have a consultation with us. It's free to tell us what's going on with your loved one, with a care facility, with what is happening and what they've been experiencing. And we'll help you figure out whether or not there's a claim there for nothing. So a lot of times we have folks call and they don't have a claim, or they don't have a claim that we can help them with for whatever reason. But because they've talked with us, we can put them in touch with either the elder abuse hotline. We can get some changes made. We can help them communicate with the physician or facility, and we can get grandma, grandpa, aunt, uncle, whoever it is, better care for no cost at all. And a lot of times I love having that conversation because that means that we have corrected the problem before that pressure wound has gotten so bad that they've become septic and they've died, and that we can prevent the harm. And a lot of times people think, well, I've got to talk with the attorney because they want to make money. I got to tell you, I would love it if we would eliminate all elder abuse and neglect cases. You and I would go do something else. We don't want this kind of claim, and I certainly don't want it for my loved ones or for myself because, but for the grace of God, we're all going to be in a facility like this. I want everybody to get great care. And so if you think you've got a claim, call us. Let us help you figure it out and make the changes now before things go bad. Because too often when we see folks, it's after things have gone so bad, their loved one has become either debilitated, disabled, or has died. And then we've got a claim, but at that point, the harm has already occurred.
That's right. Oftentimes people come to me and they tell me their story of the care the loved one received, and oftentimes the first thing we discuss is, okay, first thing, we need to get your loved one moved to a different facility. Do that first. Do that today. Get another facility. Get them better care, and then we'll start looking at whether you have a claim, a legal claim. So I would say take care of your loved one first, and then we'll get the legal claim in order. But it's just affirming their concerns and saying, yes, your concerns are legitimate. Now let's see how to fix it, whether moving to a different facility or talking to the administration and making sure that the care improves. Now, you talk about 2 things. Oftentimes, the care can get better, and the loved one gets better care, and they continue on and live the full, happy, as best life as they can. Unfortunately, there are times when they come to me and their loved one has died, whether due to the infection of a pressure sore or a fatal fall, something like that. It's important to distinguish that there are 2 types of claims generally in these cases. There is the personal injury claim that belongs to the elderly patient. And if they are alive, the claim is brought on their behalf, sometimes by them directly, or if not, by someone who's appointed to bring it on their behalf. In those really unfortunate cases where the care has been so bad that the elderly resident dies, the family would have a wrongful death claim. So that claim does not die, and the bad care isn't excused because the patient has died. The family can bring a wrongful death claim, and I've helped many families bring wrongful death claims in those bad situations where their loved one just had a fatal fall, or the pressure wounds got so bad that it took their life. So it's important to see a lawyer as early as possible. But even if it's late in the situation, still see a lawyer, because there are many things can be done. And it's the reason we have these lawsuits, and the reason that these lawsuits are brought, they do have an important effect. Nursing home lawsuits, they fix a broken system by focusing on individual violations. You're looking to fix the care that the nursing home is providing to residents just by looking at that one case, the one type of care that the individual got. In the case, the example I gave of the nursing home where the doors didn't lock. Well, after this happened, they went through and they put in the correct doors with the correct lock so people couldn't get out. So you're fixing a broken system. The second purpose is you're helping the individuals and their families hold the nursing homes accountable for the substandard care and the abuse, and providing compensation that is needed for them.
So one of the things I want to make sure that we talk about is care is bad. They're underpaid, they're understaffed, and it seems like the problem's getting worse. It doesn't have to be that way. I think that we continue to put our thumb in the dam or build the dike, or however you want to make the analogy. Is I absolutely agree with what you just said, is that while we see these problems get worse, we also see some improvements. In our area, I know that we have care facilities that are giving better care because we brought a claim, because they have fired the supervisor, because they brought in more better experienced staffs, they've revamped their policies, they've fixed their doors. And so while we can't fix every problem in every community, I do think it's important to bring these problems to light and to bring the claims on those times whenever there has been harm, because we will make it better. And so hopefully if you or your loved one ends up in a nursing home, it has been a nursing home that's been improved, that's now giving good quality care and is hiring better people and is providing better and more well-trained staff. And so while I think the problem is terrible and I think it's getting worse, I think we're seeing pockets of light that we can help make better.
That's right. That's exactly right. And even if you're just helping that one family, helping that one resident, well, that's reward in and of itself.
All right. Thank you very much.
Thank you for listening to our podcast. We hope to bring you more educational, informative podcasts in the future. We are Johnson, Vorhees, and Martucci. I'm Patrick Martucci.
I'm Scott Vorhees.
You all have a nice day.